Hello friends, today's video is about general pharmacology. There are a few basic concepts that need to be cleared as we study general pharmacology. One of such concepts is adverse drug reactions. See, when we say adverse drug reactions, we understand that drug on entering in our body, it can have a positive or negative effect depending upon the toxicity, the bioavailability, the what you call it as the reaction, the host reaction, the synergism that can be seen by other drugs. So accordingly, drugs can sometimes basically drugs are given to alter the pathophysiology for human benefit, but sometimes these drugs show us side effects, drug effects. So these side effects, or you can tell as drug effects, are classified into six categories. Six categories. They can be remembered. Adverse drug reaction can be remembered by a mnemonic called A, B, C, D, E, F. These six alphabets represent six categories of adverse drug reactions. When you say adverse drug reactions, starting with A, you have augmented. Augmented, it, it means it can be predicted. So A stands for augmented or predicted drug effect, that can be either a side effect or a toxic effect, or it can be an intolerance. So augmented makes it's predicted. So when we say predicted, it can be a side effect, it can be a toxic effect, or it can be intolerance. So when the side effect occurs? Side effect occurs when the amount of drug that is given, right? When the amount of drug that is given to the patient or to the subject has done its work, but the remaining amount of drug is not excreted, that can lead to its increased effect. Like if, for example, if a drug that is given for a patient to undergo meiosis, but a little drug will connect to the little receptors, and the left amount of the drug, if not metabolized, it will keep on stimulating that receptor to cause the desired effect. So that undesired effect that has turned into an undesired effect now is called as side effect. Now when you say toxic, toxic means when the amount of drug that has to be given is exceeded in multiple amounts. Like for example, for treating a particular kind of pathology, we need about 100 milligrams of a drug, right? But the same patient receives 1000 milligram of drug. In this case, surely this drug gonna show in the patient toxic effects. Intolerance to a particular drug, intolerance to a particular drug can be justified by saying that a very minimal amount of a particular drug or a particular, what do you call it as, toxin, antigen, or any particular molecule in a minimal of the minimal amount can lead to an adverse reaction which can be termed as intolerance. So any drug that is given to the patient, if given to the patient in amounts, so it can be augmented, it can be predicted that this drug can either cause a side effect or a toxicity or intolerance. Similarly, we head over to the B part. The B part, or the second category, it is known as bizarre effect. B stands for bizarre effects. Bizarre effects of drugs can be anaphylaxis, can be blood cytolysis, can be complex effects, and delayed. So bizarre, again, it includes A, B, C, D. So A stands for anaphylaxis. B stands for blood cytolysis. C stands for complex reaction. Well, I'll explain you everything. What is it? And D stands for delayed action. So bizarre effects, basically you can understand, it's a kind of allergic reaction or immune reaction to a drug. So one is predicted. It can predicted is easy, fine, cool. It can have side effect, it can have toxic effect, it can have its own intolerance. But in case of drugs having showing you bizarre effects, for example anaphylaxis. Anaphylaxis, as we know, is a condition in which there is a tremendous amount of mast cell secretions of chemical mediators of inflammation, as a result of which there is severe inflammation, and that can lead to bronchoconstriction and can sometimes even lead to death if not treated on time. Similarly, a drug that's entering in the body can cause hemolysis or blood cytolysis, as a result of which there is going to be jaundice, and because of blood cytolysis, this conditions such as asphyxia, anemia, etc. can occur. Similarly, because a drug has entered your system and that drug is not recognized as foreign to the system, then the system will try to mediate a complex reaction against the drug, and because of which a bizarre effect and complex, when this thing is done, again the mediators of inflammation are secreted by the mast cells. Mast cells, they secrete mediators of inflammation such as leukotrienes, histamine, etc., which are responsible for causing vasoconstriction and bronchoconstriction and vasodilation. In that case, so it's vasodilation. So in that case, bizarre effects can occur. And delayed action is again a type of hypersensitivity to a drug. Heading forward, the third category, that is the C category, is the chronic effect. Is a chronic effect of drugs. So chronic adverse effect, you can say, chronic adverse effect of a drug. So this is a C category. When it's a C category, example of such is corticosteroids. As we know, corticosteroids, these are class of drugs. They can be used as anti-inflammatory, immunosuppressive. They can be also given, they are given to patients with asthma and etc. And in case of anaphylaxis also, we prescribe the corticosteroids for reducing any kind of inflammation. Mostly in European countries they give corticosteroids, but these corticosteroids have their side effects as well, which is in long term called as chronic side effect. This part will be covered in another video. But as for corticosteroids, you can understand that corticosteroids has its own chronic side effect, chronic kind of adverse effect on the human body. An example of which is you can see due to adrenal insufficiency. Adrenal insufficiency. Now heading forward to another category of adverse reactions of drug can be the D type. The D type is considered as delayed. Now delayed, a very nice example of delayed kind of therapy, delayed kind of adverse effect of drug, adverse effect of a therapy can be seen in cancer patients, CA patients. These patients, after receiving cancer treatment, anti-cancer treatment, they get cancer. So example of delayed drug adverse effect can be seen in cancer patients, that they get cancer after anti-cancer therapy. Weird, right? But this happens due to delayed drug or therapy effect in cancer patients. Anti-cancer therapy. So now we have completed 4 types of adverse drug effects, right? Now let's move to another one, that is E, the 5th one, called as E. E is called end of treatment effect. Now what do you understand by end of treatment effect? Example, for a particular treatment we are giving a particular drug, right? So once the drugs, we as doctor, we think, okay, this drug has done its part, now we have to withdraw this drug. As we withdraw the drug, the same disorder or same reason for which we were prescribing the patient with this drug reappears. A classic example of such is clonidine. Clonidine is a hypertensive drug On withdrawal of clonidine, pardon me for the mistakes, withdrawal of clonidine, the first thing you see is increased blood pressure. So this is also an adverse effect of drugs. So we have studied A, B, C, D, E. Let's move to the F. F is very simple, fetal. Any drug can have its adverse effect on the fetal life. So F stands for fetal. So when you say fetal, it makes abortion. It leads to abortion. Second, teratogenicity, warfarin, etc. And also fetal insufficiency or defect in development. So you can say defect. See this hashtag in medicine, it stands for defect in development, right? So these are the adverse effects of drugs. So any drug entering a system, to the most of it, the adverse effects that can happen with these drugs can be understood or remembered by the mnemonic A, B, C, D, E, F. These are 6 categories of adverse effect. A stands for augmented. Augmented means predicted. So any drug entering a system can have a side effect, can be toxic or can be intolerant. Then comes bizarre effects. These are hypersensitivity effects, bizarre effects. These effects include anaphylaxis, blood cytolysis, anemia occurs, complex reaction, and delayed action. C stands for chronic. For particular drug that has been taken for a long time, it causes a chronic kind of another disorder in the patient. Such example is seen in case of corticosteroids, where it leads to adrenal insufficiency. Now the fourth one is called delayed. Delayed means a drug or a therapy given to the patient for the patient's betterment, but after the therapy, the main disease that for which the drug was given, it occurs. So this kind of adverse effect of a drug is seen in cancer patients, that cancer patients after receiving anti-cancer therapy, they get cancer again. The fifth one is end of treatment effect. Now when you say end of treatment effect, it means you have been taking, or the patient have been taking a particular drug for a long time for a particular disorder, but once the patient stops taking that drug, again the disorder for which he was taken appears. So classic example of such is clonidine, in which hypertension reappears, and clonidine is antihypertensive drug. Classes of antihypertensive drug will be covered in another video. There are classes, it's very interesting topic, we'll definitely talk about it in another video. And the sixth one is fetal adverse effects. Adverse effects that can be seen on fetal or the growing developing fetus during the fetal life. It can lead to abortion. Many of you might have heard of what you call gray baby syndrome, right? Gray baby syndrome due to chronomphenical. So it's teratogenicity. It can be teratogenic, right? And a drug can lead to defect in development.